Hello. India has just completed the first phase of the lockdown in its fight against the COVID-19. And we in this video is going to see that how the things are and after the end of the first phase of the COVID-19 fight in India, after the completion of the first lockdown, and to see that what else can be done to further strengthen the approach. So if you look into this whole global scenario and with India, if we take the case, those countries where the cases has been more than 10,000, we see that India is reporting total number of cases per 1 million population. That is more, total number of cases in 10 lakhs of population is at 8. And the test positivity rate of India is 5.11, which is sort of quite on the lower side. So if we look into the case estimations based on the 8 cases per 1 million population or 10 lakhs population, we find that it works out to be something around 110,400 cases as of now, which is like 1,10,400. And the case range will be something in the range of 100,000 to 150,000. That is 10 lakh to 15 lakh of cases. It'll be 1 lakh to 1.5 lakh of cases. This becomes, this is the scenario where we have something like 284 districts which has reported COVID-19 cases. Now, if you look into the district map of India, we see a very specific and interesting feature of this map is that we find that cases have been reported from districts far and wide across the length and breadth of the country. So we find that maybe all the districts are not reporting, have not found the COVID-19 cases as of now, but we find that the spread of the cases across the districts is very universal sort of distribution. We find cases in almost every nook and corner of the country. So this map depicts that probably with this scenario, it's only a matter of time when those districts which are not reporting cases will probably start reporting cases. Hopefully not, but the scene from this map appears to say something like that. A closer look at the map, we see that the large cluster of the cases are towards those areas where the areas have got a high economic activity and lots of people move in that from to and away from that area from other parts of India. So if you look at areas around the major cities of Delhi and Mumbai and Bangalore and Chennai and Kolkata, we find that those are the cases, those are the areas where you have a large amount of cases. And if you look at a bit closer to the map, we find that there's a track of the cases which goes from fans out from one economic zone to the other economic zone. Especially we see this from the Delhi to Mumbai, Delhi Ahmedabad Mumbai corridor. So now, if you look at the graph of where India is and how the how the country is doing in terms of the number of cases, this graph shows the daily new confirmed cases to the total confirmed cases. Now, what we see here is around from around the first week of April, there has been a slight increase. There have been, not a slight, there have been substantial increase of daily new confirmed cases. And we see that the graph, the daily new confirmed cases has risen over a period of time and have sort of reached a plateau of around 1,000 cases every day. Now, this might not be very significant, but if we look at the daily new confirmed cases being stabilizing around 1,000, but when we convert that into the total number of cases, every day adding 1,000 cases, the graph of total confirmed cases rises steeply. And there is no sign of any flattening because we see that the daily new confirmed cases is almost at its static and it's becoming to plateau off at the same level. Now, so the significant factor is that if we are not able to bring down the new confirmed cases, daily new confirmed cases below the present level of around 1,000 cases every day, we will not be able to flatten out the curve or to bring the curve down of the total number of cases. Because every day we have about 1,000 cases, it'll add to the pool of the already existing. Now, if you look into what is happening to the other countries across the world, and if you look at South Korea, Philippines, Indonesia, we find that South Korea identified the first case on 20th of January 2020. India and Philippines identified their first cases on 30th of January. Indonesia found its first cases on 9th of March 2020. But if you look at how the things has moved since then, we find in Korea, within a month or so, the surge of cases started rising, and it reached a peak around 1st of March. But then after the peak, the country has been able to sort of introduce measures which has brought down the peak almost sharply, and it has then tailed off and is still tailing off to almost the basal level or towards the zero. So we can see for the South Korea, there has been a sharp increase and almost a very sharp decline, and then there is a long tail coming towards the zero. If you look at Philippines, we find that around the first part of April, it has shown a peak, and then there was a sharp decline, and then again there has been a rise and fall, and it seems that Philippines has gone into some sort of a plateauing of the cases, and there is a sort of a flattening of the cases, and there is no additional new rise in the cases. Similarly, Indonesia also has a persistent increase of cases from 21st of March onwards, but it seems now that the number of cases is not rising so sharply and it is sort of plateauing off. But when we look into India, we find that the number of cases are rising quite sharply, and over the last a couple of weeks, it seems to have actually risen very, very persistently over this period of time. So here again, the rolling 3-day average, we see the same thing, that India is sort of sharply increasing, whereas South Korea is reaching towards the 0 point. Indonesia and Philippines seems to be sort of plateauing off its rise. This is an interesting graph in which we see that in India, the total number of cases that has been identified with COVID-19 who have recovered and those who have died. Now, the green indicates the recovery, but we see that the recovery cases has really fallen and has been fallen persistently, but seems over the last couple of weeks to have sort of stabilized towards a certain level of about 75%. But we see that the death rate has increased over a period of time, slowly but persistently, and it has sort of plateaued off around 25%. But if this feature remains as such, then there will be a gap of around 50% who will be something between have not fully recovered and have also not died. So maybe the hospital occupations of these patients will increase, and therefore the bed occupancy rate by these people, by these percentage of people, will increase. And therefore, as we go along, that this group of people who will not be recovering and also not dying will lead to possibly a problem with the beds in the country. So what else can we do? Let's see in the testing. So what I suggest over here is that to involve the private medical practitioners and healers, both qualified and non-qualified. We know in India that the first line of contact in most cases, in most community, are these local practitioners, qualified or otherwise. and they are the first line of contact between the health system and the community. I think to get involved these people, to train them and provide them with necessary equipment so that they can take the samples and send it for to the testing labs can actually make the reach of the tests increase many folds. Um, we can start using the GeneXpert machine that the TB control program has placed over the last few years. And the reach of the GeneXpert machine presently is very wide, far and wide inside the country. Unitate, which actually sells the cartridge of the GeneXpert machine, has also developed a cartridge for COVID-19. So I think the country can look into that to use these GeneXpert machines as the testing points for COVID-19. Now, we can also use the TB dots workers who are far and wide inside the country, and they can identify symptomatics, collect samples, and transport it for testing, either to the GeneXpert sites or to other COVID-19 testing sites. This can also increase the reach of the testing significantly. We can also use the HIV peer group, especially in the urban areas, to identify the symptomatics and collect the samples and send it for testing as quickly as possible. This will also increase the reach and the testing and the number of the. Now, in the surveillance, we can use the local practitioners, as I have mentioned in the previous slide, the local healers, qualified or otherwise, doesn't matter now, to be used as the people who can identify the symptomatics and do the contact tracing as well, and also follow up with the patients later on. The cell numbers can be of much use. If the government wants, they can use the cell number of the person who has been identified or symptomatic or suspect of the COVID-19, and the cell phone companies then can provide the details of the other cell phones which has been in near contact with this cell phone, and therefore reach to the owners of those cell phone, and therefore this way a network of surveillance can actually be activated. Records can be looked into, previous records, the historical records, and see that what are the other people that has been in contact with this cell phone on a certain date and time. Now, the cell phones can also be used as a good tool. Cell phone numbers can be used as a good tool to identify where the gathering takes place, because over the last few days or weeks, we have seen that people are gathering in certain areas, maybe due to rumors or some other reasons. They're sort of gathering near bus stations or railway stations or other sites, or maybe praying sites. But the cell phones data can be of very good use. The cell phone companies can be told to actually monitor if there is any collection of the cell phone numbers together at a certain place. They can immediately alert the police or the local authorities, who can take the action and check that why that's happening. This can be a very good means of surveillance. Can use the polio, HIV, TB, and malaria workers who are extensively present in the grassroots and the ground level, and therefore they can actually increase the surveillance network to the very deep inside the country. Color coding of the country is also important in these terms, like where the clusters are, the hotspots are, possible cases are, and then layer it with different types of indicators, like social indicators or economic indicators or socioeconomic indicators, unemployment rates, and therefore we can have different layers and groups of maps and color coding of the country. So lockdown, well, as of now, it's difficult to say that of how much effective it has been, because right now we are seeing a surge of cases, and the graph of total number of cases is going on increasing, and also the introduction of the new cases every day. It seems to be rising slowly up, but presently it seems to have plateaued off somewhere around 1,000 cases every day. Now, we have to see over a period of time that plateauing of 1,000 cases goes down as an effect of this lockdown of 21 days, or it again resumes its slowly upward curve. Only time after about 10 to 14 days we'll be able to say that is the number of new cases being identified every day is going up or down? And then one can comment that this lockdown has really affected or not. But at the same time, we might look into and reassess the overall approach that we are doing, especially keeping in mind the socioeconomic aspect of the whole thing and the spread that the virus has done over a period of time, and what are the measures that we can actually use in addition or in all or in place of the present approaches that. Thank you and God bless.